Jonathan, if it's okay, I'll go ahead and start, all right?
Yeah, you should be good to start. And just so you know, Miss Sampson, I just forwarded you that email.
Yeah, and you can oops, and you can share that with anybody uh, that you want. Okay, so this is actually a talk that Jonathan sat in on last month at the Montana Model United Nations, and I'm going to see if I can figure out how to get rid of that. At the Model United Nations over at the university. And he asked me, and I was kind of flattered, if I would give it to your class today. And I said, but of course. So, but since some of the numbers are out of date, I did take the liberty of changing a few things. So what I call it is Pandemic Viruses Global Citizens. And just a little bit of information for those of you that might not know, Rocky Mountain Labs, or RML, is located over here in Hamilton. I think you guys have probably all heard of that. And we have the Bitterroot. We're right on the Bitterroot River. These are the Bitterroots right here. We're right on the Bitterroot River, very close, in fact. And so this is what our campus looks like. It's about 30 some odd acres. We have about 500 people working here, 21 principal investigators who would be like a professor. And we have a bunch of people that support us, technicians, animal care staff people, safety people, biosafety, blah, blah, blah. And we work on a really broad array of infectious agents, including viruses, bacteria, and prions, which are the things that cause like chronic wasting disease and mad cow. And we work at all of the levels of biosafety, including biosafety level 2, 3, and 4. And biosafety level 4 is kind of like hot zone stuff, working on Ebola. And our focus here at the labs for over 100 years has really been on emerging infectious diseases and pandemics. So there's a few terms before we start that I want to sort of casually define for you because I'll probably refer to them in my talk, and there are things that you might be interested in knowing. So I mentioned emerging infectious diseases, and those are diseases, infectious diseases, that pop up for the first time ever, or a disease that appears for the first time in a new place, or a disease which has just been sort of smoldering along and suddenly explodes. And examples of that are Ebola virus, which was first described for the first time ever in the mid 1970s, and then COVID-19 is also an emerging infectious disease. There have been other coronaviruses, but this is the first time that COVID-19 has ever shown its face. Then zoonotic infectious diseases, those are ones that spread from animals to people. And animals means everything from insects and arthropods to rats, bats, birds, cows, and so forth. And the estimates are that about 70% of the infectious diseases that we get probably started with an animal disease. And there have been some good examples of that actually during the SARS coronavirus outbreak, because they think that probably started with a bat. And in a few places in the United States, but particularly in England, in Europe, that virus has done sort of a reverse zoonosis, and hundreds of thousands of mink, millions of mink on mink farms in the Netherlands, Denmark, and a few other, and the Netherlands, Denmark, and someplace else I can't remember, actually caught the coronavirus from the mink handlers, and a few people ended up catching it again from the mink. So what they've done over there is they're basically just wiping out the fur industry. So if you are planning on buying a mink coat next year, you might be out of luck. An outbreak is a term that you'll see thrown around, and these are kind of my informal definitions. So an outbreak is a sudden, unanticipated increase in the cases of an infectious disease in a small geographic area or a small group of people. These small outbreaks are sometimes called clusters. And before the coronavirus exploded in Montana and everywhere else, there'd be a cluster here, a cluster here, a lot of clusters in like nursing homes and places like that. And then an epidemic is sort of up the increasing in seriousness. And this is a sudden, unanticipated increase in the cases of an infectious disease in a particular geographic area. Might be a single state or a whole country. And then when it ramps up, the final is a pandemic or a global pandemic. And this is when the epidemic involves multiple countries or continents. And that's what we're in right now. And pandemics are brand new infection, typically new emerging infectious diseases are caused by new or emerging infectious diseases. So pandemics are really a special class of emerging infectious disease. And why did diseases emerge? Well, we could talk about this for a really, really long time. And if you guys read a book called Spillover by David Quammen, Quammen, who lives in Bozeman and is a really good writer. Spillover is the term that he uses to talk about animal infections spilling over into people. It's a wonderful book, and it's a Montana writer, and he's a really good writer. So there's about, close to a dozen reasons that infectious diseases emerge, and we could spend like a whole day talking about this slide. But there are ones which are particularly relevant now are increased international travel, because if a virus infection starts somewhere, if it's going to become a pandemic, it's got to get everywhere else. Worldwide transport of animals and food products, the role of mink in this, and the bats, they figure that the bats were being eaten, and that's how it may have gotten started in people. One for other pandemics has been the decreasing amount of vaccination that's going on, and I'll have a little bit to say about that in a minute. And then horribly, the declining support for public health. There have been 3 county public health officers in the state of Montana who have been threatened with their lives and all kinds of stuff, horrible, over the last 6 to 8 months, that they've actually quit. And there are a number of additional instances of that happening all over the country. That's really bad. It's going to be really bad in the long term. And then finally, political instability, which sometimes makes it impossible for the government to include control measures, and deliberate disinformation. And boy, we've seen a lot of that recently. And you guys, I'm sure, are picking up on that. And of course, multiple factors can interact. So I'm just going to show you, this is sort of a table that Dr. Fauci, who's my boss, made of all the emerging and re-emerging infectious diseases. Re-emerging ones are diseases, new diseases, which were thought to have been put to bed, but they popped up again. And this is just a partial list from about 2 years ago of emerging and re-emerging infectious diseases. Not all of these make it up to pandemic level. And parenthetically, I would add that if I were to draw a circle around the ones of these that we work on here at Rocky Mountain Labs, it'd probably be about 60 to 70% of these agents. So let's just look real quickly at a couple of ones, emerging infectious diseases, which have made it to the pandemic level. Well, first of all, the mother of all pandemics is HIV. And you guys know a whole bunch about that. When I was your age, no one had heard of this. In fact, when I was in medical school, nobody had heard of this. And this has really been, it's now though, because of all the research that's been done, has been converted from a death sentence to a manageable chronic disease. Influenza comes in a whole bunch of different flavors, H's and N's, and we could spend a lot of time talking about that. And if you guys are interested, you can ask me when we do questions. But influenzas, there's a bunch of them circulating, and occasionally one of them turns into a pandemic. In 1918, we had the only pandemic in the world that comes close to what the COVID-19 pandemic is. In fact, those are probably the two worst pandemics that 1918 flu and coronavirus. Hopefully, they're going to be the worst two that we ever have to encounter. And then there's Ebola virus that caused a pandemic, and it started off with outbreaks, but in 2014 and 16 through 16, it got into some big cities, and it sort of spread around the world. It got imported into a bunch of different places around the world, including the United States, and that was a pandemic. And some of the scientists here at Rocky Mountain Labs were actually the ones that came up with the vaccine that has really made Ebola virus a preventable disease. And then Zika virus, that one, was like 2016. So you guys should have all been conscious at that time and aware of that, and probably read about it in the paper or saw it on CNN or somewhere. This is a virus which had been around since 1936. It's named for the Zika forest here in Uganda. And if it weren't for one thing, this would be considered to be a real junior varsity level virus. The reason it's not is because it causes some horrible neurological problems in babies if mothers get infected with it at the wrong time. And the main thing you'll see is they get microcephaly, which means basically their brain doesn't develop. So these kids do not do very well. And then the one that really is very disturbing to me, and should be to you too, is that there are every year outbreaks of what are vaccine preventable pandemics. And by that, what I mean is these are pandemics being caused by infectious agents, typically, but not always, viruses, for which there's a very safe and a very effective vaccine. And the one which is really ripping and snorting around the world right now is measles. And measles is sort of this dark red color. And this is pictures from a couple years ago, but it hadn't gotten any better. And we're starting to see outbreaks of measles in the US, mumps in the US. And here in Montana, you guys have all had I hope you haven't had it, but you've all heard of whooping cough. And I hope you've all been vaccinated against it. And we have had some outbreaks of that here in Western Montana. Very, very common, again, because people don't think the vaccine works, or they're afraid of the vaccine because the government is using it to put a chip in their arm so they can track them for whatever purpose, I don't know. And so this is also a vaccine preventable pandemic that we have right here in Montana. And then polio is also starting to make a resurgence. And one of the reasons that these things pop up where they pop up is because the government instability is so bad there that it's not safe for people to go around and give the vaccine, or the people have so little trust in their governments that they refuse to get them. So that's an international issue too. And then of course we have COVID-19, which is caused by the SARS-CoV-2 or the SARS coronavirus type 2. And if you look back like in March 9th, I got this off the Johns Hopkins University website. You can see back in March, there were like 118,000 cases all over the world. And there were worldwide, there were about 4,000 cases. The US only had 800 cases in March. If you look today, bang, 67 million cases, 1.5 million, and it's probably more than that, even though this slide is from yesterday, just from yesterday. Over 1.5 million people have died. 283,000 people have died in the United States. Montana has like about 1 million people in it. So this is like basically more than 25%. That number is a little bit hard to grasp, but it's basically more than 25% of the people that live in the state of Montana. So that would wipe out Missoula, Helena, and several other cities. And in the US, we've had 14 million cases, and we are definitely number one when it comes to this. Okay, so what about Montana though? Well, if we go back to March, this is what and this is a slide I didn't show when you saw it first time, Jonathan. If you go back to March, you can see where you guys are, Lewis and Clark County, right? You had 16 cases. Ravalli County, which is where Hamilton is, had 5. The Bozeman, Gallatin County, Billings, Yellowstone County, and Cascade, which is Great Falls, they were leading the pack at that time. Not very many cases back then. But now, if we look at yesterday, holy cow, 68,000, almost 70,000 cases in the state of Montana, almost 8. And, by the end of the week, this number could be 800 because there's a few people dying every day. And you can see here, Lewis and Clark is doing their share because they've got the 3rd highest number of cases of new cases of anywhere in the state. And here's the total number. You guys have almost 1,800 cases. Billings and Great Falls and Billings and Great Falls are still sort of leading the pack. Missoula's doing a pretty good job. In Ravalli County, where we don't have that many people, we've got a lot of cases too. So this has had huge and serious impacts in our state, and you guys know it because some of you are at work or at school, and some of you are having to stay home, and you've probably had friends and relatives who've gotten sick, and some of them may have gotten very sick or even died. It's a very bad situation. Okay, so my point is that these pandemic viruses, they have local effects like we're seeing here in Montana, but they're really global citizens. They can live anywhere. And global problems require global solutions. So what does it take to address global pandemics? And this is just a partial, unofficial list that I made up. Well, we need to have continuous international surveillance, which means people looking for new pandemics and new infectious diseases that are arising. That's going to require ecological investigations because so many of these infections arise in animal reservoirs. And we have to have urgent, robust responses to these outbreaks when they're just outbreaks, so we can keep them from becoming pandemics. And then we need to have coordinated international response to pandemics because the viruses don't obey the border signs or immigration rules. We have to have prioritization of immunization programs against the shots that you all already and I already get, as well as new ones that come out. There has to be international trust, cooperation, and collaboration because, again, these are global problems. One country on itself can't handle it. And there has to be trust, cooperation, and collaboration, as I said, and there needs to be open communication. And we have to be able to share the research findings and information and tools that the scientists develop quickly. That a friend of mine calls that science without borders. And of course, what does it take? If you don't have the scratch, well, nobody's going to be able to do anything. Well, what do we have to do that with? Well, we have the World Health Organization. Does a great job, but guess what? The United States pulled out of the World Health Organization. We need to have, children are usually disproportionately affected by pandemics and serious infections. So UNICEF, which I'm sure you've all heard about, is also important. Then organizations like the Bill and Melinda Gates Foundation, They provide a lot of money and expertise to fight pandemics and identify pandemics. Then there's a little newsletter that comes out every day called ProMed, and it's a ProMed digest. And this is where the first reports of the new infectious disease in China popped up on ProMed, December 31st. And then there's a great group called Doctors Without Borders, Médecins Sans Frontières, or MSF, and they are not affiliated with any government. So when there is an outbreak, they're able to go in right away without having to get official permission, and they do a terrific job. And then we have our CDC, Centers for Disease Control and Prevention, although they've been a little bit handicapped in the current president's administration. And then there's CDCs in other countries too. And then other non-government organizations, like something called EcoHealth Alliance, which really does a lot of surveillance and early investigation. So I'm getting close to the end. So I just want to remind you of a book that some of you may have read called A Tale of Two Cities by Charles Dickens. And this was a story that was set, you may have read it in English, was set in London. I know they made us read it when I was in high school. Set in London and Paris during the French Revolution, which was in around 1789. And the first paragraph of that story, short novel, says, "It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. It was the epoch of belief. It was the season of darkness, it was the spring of hope. It was the winter of despair. We had everything before us, we had nothing before us. In short, that period was so far like the present period." Okay, he wrote that in 1859. That could have been written this morning. And why do I say the best of times and the worst of times? Well, we have the smartest people ever. We have the best technology, the best research, the best communication, and the best opportunity for collaboration and all the things I mentioned. But it's the worst of time because people don't trust each other, even in the state of Montana and probably in Helena, certainly here in the Bitterroot. They don't trust each other. The governments of our country don't trust the governments of other countries. And there's some reason for darkness. There's deliberate disinformation out there. There is the disregard and the denigration of public health. So that's the worst of times. But so what's it going to be? Well, best of times or worst of times, guess who's going to have to figure that out? It's going to be you guys as you go to college and grow up and become parents and community leaders, which I hope you all will. So that really is sort of the end of my sermon, but I want to just share one more thing with you. So what we learned from the HIV/AIDS pandemic, you need to commit substantial financial and human resources. Okay, we've done a pretty good job with that all around the world. We have to enlist the best and the brightest scientific investigators in basic and clinical research domestically and internationally. The scientists and the doctors and the nurses and the healthcare workers have done their job. We have the vaccine that I told you about, went from an infection that nobody knew about a year ago today to a vaccine which is going to start being given to people, even in the United States here, probably in the next week or so. Have to engage the affected community. Well, in a pandemic, the affected community is all of us. And we haven't done a very good job with that because there's a lot of people in Montana that don't even believe that the coronavirus pandemic exists. There are people that don't think we should worry about preventing it. And there are people who are saying, guess what, we don't really need a vaccine either. So that's going to be a real issue. And we need to be able to foster cross-sector and country collaboration with industry, academia, global organizations, other governments, philanthropies, and NGOs. We're doing a crappy job of this. And finally, we have to garner the support of leaders and policymakers. Well, that's not working so well either. So the best of times, the worst of times, you can see what the problem is going to be. And then I want to share one slide since the vaccine came out today. And this is a slide I didn't show at the UN. So a friend of mine in Australia named Ian McKay, he uses the model of defending against pandemics like the coronavirus is like slices of Swiss cheese. Masks are one slice. Some virus can get through that slice. Physical distancing, hand hygiene, not touching your face, limiting your time with other people, these are all slices of the Swiss cheese. Vaccines are another slice of the Swiss cheese. So any one individual slice of Swiss cheese, including the vaccines, some of the virus is going to get through. But just like with a block of Swiss cheese, if you have the whole block of Swiss cheese, you can't see all the way through it, even though you can see through the individual slices. So even after we have the vaccine, we have to remember that's only one slice of the Swiss cheese of prevention, and we can't forget about these other ones. Some of these are individual responsibilities, like washing your hands and wearing a mask, and some of them are community responsibilities, like and government responsibilities, like the vaccines and things like that. This is an important one for you to remember, and I hope that you all print off a copy of that and show it to your family members and your friend and the other students who aren't in this class. And so with that, I want to thank Dr. Fauci, who's my boss, gave me a bunch of the slides to use, and some other people. And then finally, that's a picture of Dr. Fauci on the cover of a Washington, D.C. magazine a couple of months ago. And there he is. You can see his message, wear a mask. And I should also, before I completely sign off, it looks like I talked too long, tell you that the Mansfield Center at the University of Montana is going to be sponsoring a virtual talk by Dr. Fauci on February 17th. And there'll be information about that in the media, I'm sure. But if your teacher writes down, or Jonathan writes down and shares with you, Mansfield Center, University of Montana, Fauci, you'll be able to keep up on when the invitations for that go out. And with that, that is my story, and I'm sticking to it. And if I didn't talk too long, Miss Sampson and Jonathan, I'd be happy to answer any questions.